Have you ever looked closely in the mirror, noticed dozens of tiny dark dots across your nose, and immediately thought, I have terrible blackheads? If so, you're not alone. Millions of people spend years scrubbing, squeezing, and buying product after product to get rid of what they believe are clogged pores. Yet somehow the dots always come back. A pore strip seems to work for a day or two. A facial scrub makes your skin feel smoother for a few hours. Then everything looks exactly the same again. That frustrating cycle often leads people to believe they simply haven't found the right product yet. But what if the real problem isn't your skincare routine? What if you've been trying to remove something that was never supposed to disappear in the first place? I'm Dr. James Carter, and today we're going to separate skincare myths from medical facts. By the end of this video, you'll understand why some pores should be left alone, why others benefit from treatment, and how a few simple changes can make your skin look healthier without damaging its natural barrier. The first thing to understand is that the term clogged pores is often used far too broadly. Many people assume every dark dot on the face is a blackhead. In reality, several completely different conditions can look surprisingly similar, especially under bright bathroom lighting or a magnifying mirror. Some are perfectly normal structures that every healthy person has. Others are genuine blockages that can improve with the right ingredients. And some are trapped beneath the skin, where squeezing them may do far more harm than good. Treating all of these conditions the same way is one of the biggest reasons people become frustrated with their skincare results. When a treatment doesn't work, the common reaction is to use it more often, scrub a little harder, or buy a stronger product. Unfortunately, that approach may irritate the skin, weaken its protective barrier, and make pores appear even more noticeable than before. Healthy skin has texture. Healthy skin has pores. The goal is not to erase them completely. The goal is to understand what you're seeing, so you can choose the right solution instead of fighting the wrong problem. Because once you know the difference between a normal oil structure, a true blackhead, and a whitehead hidden beneath the surface, your entire skincare routine begins to make much more sense. So before we talk about exfoliating acids, retinoids, or expensive pore treatments, let's first answer the most important question of all. What exactly are those tiny dots you're trying so hard to remove? Now that we've established not every visible pore is a problem, let's take a closer look at what you may actually be seeing in the mirror. The first, and most commonly misunderstood, is something called a sebaceous filament. Despite the unfamiliar name, sebaceous filaments are completely normal. They are tiny tube-like structures inside your pores that help move your skin's natural oil, known as sebum, from the oil gland to the surface of your skin. Without them, your skin would struggle to stay properly lubricated and protected. Sebaceous filaments are usually easiest to see on the nose, chin, and the center of the forehead, because these areas naturally produce more oil. They often appear as tiny gray, yellow, or slightly darker dots that are evenly spaced across the skin. Because they resemble blackheads, many people spend years trying to remove them. The problem is that even if you squeeze one out, it will gradually return. Not because your skin is dirty, not because the pore became clogged again overnight, but because your oil gland continues doing exactly what it was designed to do. A true blackhead is different. A blackhead forms when excess oil and dead skin cells collect inside a pore and create a real blockage. The opening remains exposed to the air, allowing the material near the surface to oxidize and turn dark. That dark color isn't dirt trapped inside the skin. It's simply the result of exposure to oxygen. Unlike sebaceous filaments, blackheads usually appear as individual spots rather than a uniform pattern. They may develop on the nose, forehead, cheeks, chest, or back, and they often improve gradually when the underlying buildup is controlled. Then there are whiteheads. A whitehead also forms from trapped oil and dead skin cells, but in this case, the opening of the pore remains covered by a thin layer of skin. Because the blockage isn't exposed to air, it stays white or flesh-colored instead of turning black. This is why trying to squeeze a whitehead can be especially damaging. The blockage sits beneath the surface, and excessive pressure may push inflammation deeper into the surrounding tissue instead of removing it. Understanding these differences changes the way you think about skincare. Sebaceous filaments are part of normal skin. Blackheads are open blockages. Whiteheads are closed blockages. 3 conditions, 3 different causes, and often 3 different approaches. But even after identifying which type you have, Another question remains. If pores can become clogged, why do they also seem to become larger as we get older? Is that actually happening, or is it another skincare myth? Let's answer that next. One of the most common promises in skincare is also one of the most misleading. Shrink your pores. Erase enlarged pores. Get poreless skin. These claims appear everywhere, from social media videos to expensive skincare advertisements. It's easy to believe that if a product can make your pores look smaller, it must also be able to permanently change their size. But that's not how your skin works. The truth is that your pores are a natural part of your anatomy. They are the openings of hair follicles and oil glands, allowing sebum to reach the surface and help protect your skin. Their basic size is largely determined by genetics, meaning no cream or serum can permanently make them disappear. That may sound discouraging, but here's the good news. Although you can't permanently shrink a pore, you can absolutely make it appear much less noticeable. The key is understanding why pores become more visible in the first place. The first reason is congestion. When oil and dead skin cells begin collecting inside a pore, the opening stretches slightly to accommodate the buildup. Even before a true blackhead forms, that extra material can make the pore stand out more than usual. The second reason is aging. As we grow older, our bodies naturally produce less collagen and elastin. These proteins act like the structural framework that supports the skin around each pore. When that support gradually weakens, the surrounding skin becomes less firm. As a result, pores may appear wider or more elongated, even if they haven't actually changed very much. Years of unprotected sun exposure can accelerate this process, which is one reason sunscreen plays such an important role in maintaining healthy-looking skin. The third reason is irritation. Many people unknowingly make their pores appear larger by using products that are simply too harsh. Over-exfoliating, scrubbing aggressively, or constantly picking at the skin can trigger redness and inflammation. When the tissue surrounding a pore becomes irritated, the opening often becomes more noticeable because of the increased contrast between healthy and inflamed skin. This explains why some people feel their pores look worse after starting an overly aggressive skincare routine. The goal isn't to fight your pores. The goal is to reduce congestion, protect your skin's natural structure, and minimize unnecessary irritation. Once those three areas improve, your pores often look cleaner, smoother, and less visible, even though their actual size has remained largely the same. Unfortunately, many people unknowingly do the exact opposite. Some of the most popular pore cleaning habits can actually increase irritation and keep the cycle going. Let's take a closer look at those mistakes next. Once people notice blackheads or enlarged pores, their first instinct is usually to remove them as quickly as possible. That reaction is understandable. Unfortunately, some of the most popular quick fixes can leave your skin more irritated than before. Let's begin with the first mistake: constant squeezing. It can be tempting to stand in front of a magnifying mirror and press every tiny spot that catches your attention. Sometimes a blockage comes out, making it feel like you've solved the problem. But repeated squeezing places significant stress on the surrounding skin. Excessive pressure can damage the delicate wall of the pore, increase inflammation, and in some cases even leave long-lasting discoloration or small scars. If the material inside the pore is pushed deeper instead of outward, the irritation may actually become worse. The second mistake is relying too heavily on pore strips. These adhesive strips can remove some surface debris and temporarily make the skin look cleaner. That's why many people enjoy using them before a special event. However, the improvement is only temporary. Pore strips don't change how much oil your glands produce, nor do they prevent dead skin cells from collecting again. Within days, the pore often looks exactly as it did before. Using them too frequently may also irritate sensitive skin, especially around the nose. The third mistake is over-cleansing. Many people assume oily skin should be washed repeatedly throughout the day. In reality, cleansing too often or using harsh soaps that leave the skin feeling tight can strip away protective oils that help maintain a healthy skin barrier. When that barrier becomes disrupted, your skin may feel dry, irritated, and more reactive. Some people even notice increased oil production afterward as the skin tries to compensate for the dryness. Healthy skincare isn't about being aggressive. It's about being consistent. A gentle cleanser used morning and evening is usually enough for most people. The goal is to remove excess oil, sunscreen, makeup, and daily impurities without stripping away everything your skin needs to stay balanced. If you've been relying on squeezing, pore strips, or harsh cleansing, don't worry. You haven't ruined your skin. The encouraging news is that there are ingredients supported by research that can help keep pores clearer over time without causing unnecessary irritation. The question is knowing which ingredients are actually worth using. And that's exactly what we'll explore next as we compare two of the most effective exfoliating acids in modern skincare, BHA and AHA. Now that we've covered the habits that can keep pores congested, let's talk about something that truly can make a difference when used correctly: chemical exfoliants. The word chemical sometimes sounds intimidating, but these products don't work by harshly scrubbing the skin. Instead, they gently loosen the bonds that hold dead skin cells together, allowing them to shed more evenly. Two of the most common types are BHA and AHA. Although they are often grouped together, they work in different ways. Let's start with BHA, also known as salicylic acid. Salicylic acid is oil-soluble, meaning it can travel through the natural oils on your skin and reach deeper into the pore. There, it helps loosen the mixture of oil and dead skin cells that contributes to blackheads and clogged pores. For people with oily skin or frequent blackheads, this makes BHA one of the most useful ingredients in a skincare routine. AHA, on the other hand, works primarily on the skin's surface. Rather than focusing on oil inside the pore, AH as help remove dead cells from the outermost layer of the skin. This can improve rough texture, uneven tone, and dullness while leaving the complexion looking smoother and brighter. If your primary concern is blackheads, BHA is usually the better place to begin. If you're more concerned about dry, rough skin or signs of sun damage, an AHA may be more beneficial. Some skincare routines include both ingredients, but using them together too aggressively can overwhelm the skin, especially if you're just starting. A common mistake is assuming that more exfoliation means faster results. In reality, overusing acids can weaken the skin barrier, leading to redness, dryness, burning, and increased sensitivity. For most beginners, using a chemical exfoliant 2 or 3 evenings per week is often a sensible starting point. As your skin adjusts, frequency can be increased if needed and if your skin continues to tolerate it well. Patience is just as important as choosing the right product. Visible improvements usually develop gradually over several weeks, not overnight. Healthy skin responds far better to steady, consistent care than to aggressive treatments performed all at once. Of course, exfoliation is only one part of the picture. Even the best exfoliating ingredient can't compensate for an incomplete skincare routine. The products you use every single day, especially your cleanser, moisturizer, and treatment products, play an equally important role in keeping pores healthy over the long term. Let's put those pieces together next. By now, we've discussed what clogged pores are, why they develop, and which ingredients can help keep them under control. The next step is putting that knowledge into a simple routine you can realistically maintain. One of the biggest misconceptions in skincare is that an effective routine has to be complicated. In reality, consistency almost always matters more than the number of products you own. Everything begins with a gentle cleanser. Your cleanser should remove excess oil, sunscreen, makeup, and daily impurities without leaving your skin feeling tight or uncomfortable afterward. If your face feels overly dry immediately after washing, the cleanser may be more aggressive than your skin actually needs. Remember, cleansing is about restoring balance, not stripping your skin. The next product to consider is a retinoid. Retinoids are vitamin A derivatives that encourage skin cell turnover, helping prevent dead skin cells from building up inside pores. Over time, they can also improve skin texture and soften the appearance of fine lines, making them a valuable long-term addition to many skincare routines. However, more is not better. Many people experience irritation because they apply too much or use it too frequently during the first few weeks. A pea-sized amount for the entire face is usually sufficient. Starting 2 or 3 nights per week allows your skin to adjust gradually before increasing the frequency if tolerated. Another helpful ingredient is niacinamide. Unlike exfoliating acids or retinoids, niacinamide doesn't work by removing dead skin cells. Instead, it supports the skin barrier, helps regulate oil production in some individuals, and may reduce the appearance of enlarged pores over time by improving overall skin function. It also pairs well with many other skincare ingredients, making it an easy addition for people looking to keep their routine simple. No routine is complete without a moisturizer. Some people with oily skin avoid moisturizers because they worry about making their face feel greasier. Ironically, dehydrated skin often becomes more reactive and uncomfortable, making it harder to tolerate ingredients like salicylic acid or retinoids. Choosing a lightweight, non-comedogenic moisturizer helps maintain the skin barrier while supporting the treatments you're already using. When these products are introduced gradually and used consistently, they often deliver better results than constantly switching from one trending product to another. But there's one final step that many people continue to underestimate. Without it, even an excellent skincare routine may struggle to produce lasting improvements. Let's finish by talking about the habit that protects every investment you make in your skin, and the realistic expectations you should have along the way. After everything we've discussed, you may be wondering what your skincare routine should actually look like. The good news is that you don't need a cabinet full of expensive products. You don't need to scrub your face every night, and you certainly don't need to chase every new skincare trend that appears online. For most people, a simple, consistent routine is far more effective than an elaborate one that's difficult to maintain. In the morning, begin with a gentle cleanser if your skin feels oily or if you applied skincare the night before. Follow with a lightweight moisturizer that suits your skin type, then finish with a broad-spectrum sunscreen of at least SPF 30. This final step is often overlooked, but it's one of the most important habits for maintaining healthy-looking skin. Daily sun protection helps reduce the long-term effects of ultraviolet exposure, which can contribute to uneven skin texture, premature aging, and make enlarged pores appear more noticeable over time. In the evening, cleanse your skin again to remove sunscreen, makeup, excess oil, and the impurities that accumulate throughout the day. If you're using a salicylic acid product or a retinoid, apply it exactly as directed and introduce only one new active ingredient at a time. Giving your skin several weeks to adjust makes it much easier to identify what's helping and avoids unnecessary irritation from changing too many products at once. If your skin becomes dry, tight, or sensitive, don't assume the treatment isn't working. Sometimes your skin simply needs a slower pace. Reducing the frequency for a short period and continuing with a gentle moisturizer is often enough to restore comfort, while allowing you to stay consistent with your routine. It's also important to remember that healthy skin has pores. No treatment can erase them completely, and anyone promising permanent, poreless skin is setting unrealistic expectations. The real goal isn't perfection. It's cleaner pores, smoother texture, and healthier skin that feels comfortable every day. Finally, if you develop painful acne, frequent cysts, persistent inflammation, or pigmentation that doesn't improve despite consistent skincare, don't hesitate to seek advice from a board-certified dermatologist. Prescription treatments or professional procedures may be appropriate depending on your individual situation. Thank you for spending this time with me today. I hope this discussion has helped you better understand your skin and feel more confident about caring for it. If you found this video helpful, consider subscribing for more evidence-based health and skincare information designed to help you make informed decisions. Until next time, take good care of yourself, and I'll see you in the next video.